So, what is credentialing in the U.S. healthcare? It is the rigorous process of, evaluating and verifying the qualifications, professional history, and competency of healthcare providers. So that includes our physicians, nurses, and other healthcare professionals. And we have to ensure that they meet the standards required for delivering quality patient care. This thorough process involves the verification of their medical licenses, certifications, education, training, work experience, the references, and any relevant qualifications to establish their eligibility to work in a healthcare organization or provide care to patients. Credentialing also plays a crucial role in maintaining patient safety, upholding regulatory compliance, and enhancing the overall quality of healthcare services.